All right, let's go ahead and get this seminar started. No more waiting. This is my reversing neuropathy seminar. So if you're here with neuropathy, then you're in the right place. Let's talk about how to reverse neuropathy. Now, I've put this in here, how to get lasting relief, and you'll notice that's crossed off there. This seminar is not about getting relief from your pain, burning, tingling, numbness, cramping. This seminar is about how to reverse neuropathy, and it's really important to make that distinction. Try and get relief from gabapentin, Lyrica, Tylenol, amitriptyline. Those things are designed to relieve your symptoms. That is not what we're talking about today. If you're here to reverse it, then you're in the right place. So as it says right there, I am the author of this book, Reversing Neuropathy, Making the Impossible Possible. You can get it on Amazon. It's $19.97 or $19.95. I'd highly recommend it. I know I am biased, but hey, I'm the author. I can be biased. I want to give you a few other things as well, because my goal with this seminar is to give you real rock solid information that you can take away from this and begin to reverse your own neuropathy. Go onto YouTube and type in my name, Dr. Brian Prax. On YouTube, I have a channel, 5,500 subscribers who are getting really good content. I have like 300 videos on there about what we use here in the office in order to reverse your neuropathy, okay? The next thing that I do is you can go on to Facebook. You're going to look up Dr. Brian Prax, Facebook support group, neuropathy Facebook support group. Ask to join, we'll let you in. All of these things are free, not the book, but all these things are free except for the book. And these are great ways for you to get going on reversing your neuropathy. So let's get going right here too, okay? Now, what would a seminar be without talking about what is neuropathy and what's the definition of this thing? The first thing I want to let you know is that you're not alone. Look, 8% of the population, about 24 million Americans suffer from peripheral neuropathy, and millions of people are going undiagnosed every year. So now it can occur at any age, but it's a chronic and progressive condition. So most often it's going to affect our aging population, the older folks, okay? Now, 30% of neuropathies have to do with diabetes and even pre-diabetes. That means there's 70% others out there that are coming in with other things that are causing neuropathy. So if you're thinking, I've already been tested, I don't have diabetes, okay, but there's 70% of other conditions that can cause it as well. Here's where we're going to define it. I find people are just so confused with this peripheral neuropathy thing. What is it? Let's define it. Watch. The anatomy of the body is pretty complex. So as scientists, we like to make it as simple as possible. So watch this. Anything that's in the center of your body, that's going to be called the central nervous system. Look, the brain and the spinal cord. Together, the brain and the spinal cord in the center of the body, that's what's going to run all the systems, organs, cells, tissues. Everything is managed and run by this central nervous system. Well, unlike your cell phone, your nerves are wired, and these nerves wire up and go to every single organ and tissue of your body. The nerves that leave your neck and go down the arms into the hands and the fingers, the nerves that leave the center part of the lower back and go down into your legs, your feet, and your toes, and the nerves that leave your brain. Any nerve that leaves the central nervous system, we simply call it the peripheral nervous system. Not too complex. All we need to know now is apathy. What's apathy? A problem with. Okay, so a peripheral neuropathy means you got a problem with the nerves that leave the brain, the neck, or the lower back. You got a problem with it. Most often, again, diabetes, chemotherapy, and several others, most often neuropathy has to do with death and dying or diseased blood vessels. It's often a circulation problem. If the microcirculation, look at this here, if the microcirculation is dying off, shriveling up, then that means that the nerves that those little blood vessels are going to are also not getting the oxygen, the glucose in, the carbon dioxide, the waste products out. If that's happening, It's just like a hose that's kinked and going to your plant. It's going to shrivel and die eventually. It just so happens when nerves shrivel up and die, they hurt and they burn and they tingle. And ironically, they can feel numbness. Okay, that's what happens when they die. Now, I said this earlier, there's 102 known causes of peripheral neuropathy. The top three that we see by far is diabetes, chemotherapy, and medication-induced neuropathy. Another one, number four, that we see, I would have to say, is called idiopathic neuropathy. If you've been diagnosed with that, that just means the idiots don't know what the cause is. It doesn't really mean that. It just means we don't have a cause, okay? So sometimes there's just no cause. We can't figure it out. But there's other things like Agent Orange-induced neuropathy, mold-induced neuropathy, Guillain-Barré syndrome. There's pinched nerves, scoliosis. There's a whole bunch of different causes. Now, it's weird that I said 102, right? So the two new causes that we're discovering now is COVID and COVID vaccine. Yes, I've seen neuropathies from both of those. So we'll cover those as well because bacterial infections and, like COVID, viral infections can also be causes of neuropathy. So we always have choices, and I'm glad you're here today because the choice that you're making is, I need to do something about this. Most of you have already been to your primary doctor. Some of you have already tried let me just try and live with this thing. A lot of times you go to your primary doctor and they say things like, you have neuropathy, there's nothing you can do, try this gabapentin, try this Lyrica. If that doesn't work, swing back in 6 weeks, 8 weeks, we'll increase the dose, right? And then, oh, well, that doesn't work. Okay, let me send you on over to the neurologist, right? The creme de la creme of Western medicine. Now, the neurologists, they're known for running special studies. They might run an EMG, NCV. They might run an MRI. They might send an X-ray of skin punch biopsy, a whole bunch of different things they can do to determine a cause of the problem. But usually their treatment is, here, try this gabapentin. It's a really frustrating cycle, right? So perfect segue. You got to know this. This is really important. Gabapentin, Lyrica, amitriptyline, Tylenol, Advil, all of these things are only going to mask your symptoms, okay? Just because the wolf is coming and you bury your head in the sand doesn't mean that the wolf's not going away, all right? Just because your car is making a lot of squeaky noises because you're almost out of oil and you just turn up the speakers, that doesn't mean it fixes the underlying problem. And I just want you to know that you will never be able to gabapentin your way out of this thing, okay? Lyrica is never going to fix your peripheral neuropathy and your dying nerves. And I think you know that. It's really designed to treat your symptoms and help you to be, well, like Pink Floyd said, comfortably numb, okay? So if you're really looking, though, to reverse the damage of neuropathy, and you're looking to fix the nerve so that you can actually get your life back, then pay attention. Let's go to the next screen, okay? So gabapentin, also known as Neurontin, is a anti-seizure medication. It's authorized by the FDA for seizure treatment. I know, you're like, what? I've never heard of that. But doctors have found that it can also help with pain syndromes. I want you to get this too, okay? It can help with the symptoms of pain, burning, sharp electrical pains, things like that. But your gabapentin is never going to help with tingling, balance problems, numbness, and things like that. It might help with the symptoms of pain, but it's not going to help with numbness. So if I were you and you're taking it for numbness, forget about it, as they say in The Godfather. Forget about it. It's never going to help out with that. You can't drug your way out of numbness, okay? So, but also look at this. Side effects. Now, these are common. Look them up. Don't worry, I did it for you. But it can lead to things like infection, balance problems, blurred vision, double vision, dizziness, drowsiness, fatigue. Have you had any of these things? Headache, peripheral edema, tremor, weight gain, visual field loss, accidental injury, and dry mouth. But look at this. What? It can include things like abnormality in thinking, amnesia, forgetfulness, joint pain. Look at the skip down here. Neuropathy? Yes, look it up. Gabapentin Neurontin has a side effect of burning, tingling, and numbness in the extremities. I know, you're like, mind blown. What do you mean? I thought that's why I was taking it. Crazy, 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 right? It can actually be a cause of neuropathy. Lyrica is the new kid on the block here. Lyrica really hasn't been shown to treat the symptoms of neuropathy as good as gabapentin, but sometimes these non-opioid medications are used because they're non-addictive. They can kind of mess with the brain. They really do affect the synapses in the brain. But Lyrica has its own list of side effects as well. Hit pause on this and you can see that, take a picture of it or Google it yourself. You really should Google side effects of every single medication you're taking. All right, so let's go on to the next screen. I love this one. Okay, we've been getting a little scary right here, but there is hope. NIH, the National Institutes of Health, have said in their research, quote, peripheral nerves have the ability to regenerate as long as the underlying nerve cell has not been killed. They go further on in their research to find that about 85% damage or less, and the nerves can come back. And that kind of makes sense. If I forgot to water the plant and kept the shades drawn, and 85 to 90% of this thing is damaged, we may not be able to bring it back. We might, but we may not be able to bring it back. It's really the same with nerves. If you've done some severe damage, 90, 92, 95% of the nerves are gone, it might be too late. So I do agree with the NIH. Peripheral nerves can regenerate. We're going to show you how to do that. I know you're excited, right? Here we go. 3 simple steps. 3 simple steps. I could add a fourth one too, but 3 simple steps. Metabolic, circulation, regenerate the nerves. Fourth one, get rid of inflammation. And we get rid of inflammation from the top 2. So metabolic, you are what you eat, okay? If you're trying to feed these nerves, they can regenerate. I want you to get that. They can regenerate. But you are what you eat. So if you're eating crappy food and expecting Chick-fil-A and McDonald's, no offense to those restaurants, but if you're eating nutritionally bankrupt foods and you're trying to grow some nerves, which are really difficult to grow, you're going to have a hard time. So get on an anti-inflammatory diet, okay? Like what you're seeing here. Hey, look at this. Look, 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 look. See that right there? Little chocolate bar right there, right? So we can have a chocolate bar. So super exciting. But this is an anti-inflammatory diet that can actually help the nerves to regenerate. Next screen. There is a Nobel Prize winning molecule, and it's called nitric oxide. You can't buy it. You can't have it in a supplement. It's nothing we can because it's a gas. It doesn't live very long out there in nature. As soon as you make it, it like dissipates. Only the body can make it. But who cares? The reason you should care is because nitric oxide has been shown in the research to increase circulation. Well, we just talked about it earlier. Most neuropathies have to do with a circulation problem. If all your hoses are kinked, how are you supposed to grow those nerves? So we need to have a strategy to improve circulation in most cases. Turns out that special lights, infrared lights at a specific frequency, when applied, increase circulation right to the local area. So we use a set of lights in our clinic. And for many of our patients that are from far away, we send them home with these lights. They self-apply instantaneously right to the feet or the hands or wherever we're applying that, increases circulation to the foot and therefore all the tissues there, including, the nerves. Does it feel better instantly? A lot of my patients say it does, but this is not about relieving your symptoms. It's about fixing the nerves. I really need you to get that. Let's go to the next one. So we said regenerate. NIH said nerves can regenerate or rebuild. This is a tool. It's an electrical tool that's similar to a TENS unit, but TENS blocks pain. This doesn't block pain. It uses a specific frequency that actually stimulates growth in the nerves. You can actually get them to grow, much like fertilizer helps a plant to grow. Okay, so get the inflammation down, rebuild the nerves, regenerate the nerves with a tool like this. I've seen no other that does it like this. Get a good anti-inflammatory diet and get the circulation up there. That's our secret. Now, you're wondering, because I know, yeah, I'd be skeptical too. If I went to my doctor and they said, you have neuropathy, there's nothing that can be done. Then you go to the neurologist, you have neuropathy, there's nothing that can be done. I would be skeptical too if I was sitting in this chair like you are. So this is the most frequently asked question. Well, this sounds really good. How come my doc doesn't know about this? So it's real simple. There's about 4 different reasons. First of all, your primary doctor is considered a generalist. There's nothing wrong with that, but they're going to treat any and all human conditions, anything from AIDS all the way to the Zika virus, from A to Z. They're going to treat COVID, a broken bone. A lot of times they'll refer out, but they'll treat any of these things, including peripheral neuropathy. Now, when you're a generalist treating 10,000 different conditions, there's no way you could get good at any one of those, right? But the specialist can. The specialist, like a neurologist, doesn't focus on all things that a human could have. They only focus in on neurology problems, and peripheral neuropathy fits within neurology. Now, a neurologist might treat 500 different things, and that's much more concise. So everything from MS, Lou Gehrig's disease, stroke, peripheral neuropathy, these migraine headaches, these are things that a neurologist will treat. And they can get a lot better because there's fewer things to focus on. Now, there should be one other right here, and that's me. And that's the master of one. You got to understand, I'm more specialized than even a neurologist because I don't treat stroke, MS, Lou Gehrig's disease, or anything like that. I only treat one condition, and it's peripheral neuropathy. You could say that I'm the master of one versus the jack of all trades. Okay. So that's why I like to say this, I'm about an inch wide, but a mile deep, right? So all of my energy, all of my focus, all of the research, all of the seminars, everything is only going to be neuropathy. Now, I wrote a book on neuropathy. I wrote one in Spanish. I have the support group. I have videos that I put on YouTube, like we told you about. I'm not telling you that to pat myself on the back and try to impress you, but rather to impress upon you that this is all I do. So when I travel the United States and look for the latest and the greatest, it's all I focus on is anything related to neuropathy. So there's some reasons. But also, medical students are going to receive about 20 hours of nutritional education spread out over their 4 years of schooling. They don't receive any education on anything alternative, anything outside of the usual medicine, right? Pharmacology and surgery. That's what they study. There's nothing wrong with that. We need drugs. We need surgery. I don't doubt that at all. I've had a surgery on my knee. I've had drugs from time to time as well. But if that's all your focus is on whatever the pharmaceutical companies are telling you or what the insurance says that you can do, and that's all you do, you don't have time to go outside and start studying everything. Docs are busy, right? So they don't get any education on this stuff. So doctors are really going to practice what they're trained to teach. It's the same with me. I practice neuropathy because that's all I focus on. So they're focusing on giving drugs to treat your symptoms. There's also the Medicare guidelines, section 2251.3. Let's go to that one here. Doctors aren't really practicing medicine or healthcare anymore. They're really practicing whatever insurance will let them do, right? I know you've run into that. My insurance won't allow that. Wow. Whatever happened to the doctor deciding what's best for the patient? It's not like that anymore. It's managed care. Some people say mangled care, right? Doctor recommends something, you got to get it approved by your insurance, or insurance won't cover that. You can only come in every 3 months or whatever this nonsense is. You got non-medics doing medical care. But anyway, let me get off my soapbox. Medicare guidelines, section 2251.3. Quote, a treatment plan that seeks to prevent disease, promote health, and prolong and enhance the quality of life, or therapy that is performed to maintain or prevent deterioration of a chronic condition, sounds good so far, is deemed not medically necessary? That's crazy. Why is it deemed not medically necessary? Because the science or the field of medicine and insurance that pays for medicine is not into chronic conditions. They're not into things that progressively worsen. They're into acute conditions. They're not into fixing things, they're into treating symptoms. So for your peripheral neuropathy, or maybe a better example for your diabetes, okay, they're going to give you the Lantus, they're going to give you metformin, they're going to give you Trulicity, they're going to pay for amputations of toes and feet, they're going to build you ramps, and they're going to get you wheelchairs and take care of your kidney when that starts failing. But they won't pay for a doctor to sit down and show you how to eat properly so you can reverse your diabetes. I think it's so frustrating because they could save millions of dollars if they spent time teaching people about lifestyle, but they don't pay for that. So why don't doctors understand this stuff? Because insurance isn't going to allow for it. Talk to your congressman, I guess. It's ridiculous. So, guys, we talked about earlier these three choices. You could do nothing and just try to live with this neuropathy. You probably have already been to your primary doctor, and you may have been to a neurologist, but that might be the next step. But it's basically going to be wait and see, give you some gabapentin, and then do some tests and increase your gabapentin. There is another choice, and I'd like to offer it, and that is to see if you qualify for the Blueprint to Neuropathy program. What's that? That's our reversing neuropathy program. We call it a blueprint because just like a contractor would use, if you know that you have a house you're trying to build and somebody's laid out the entire blueprint of how things look and where they fit and what the roof's like and all the dimensions and everything, all the contractor has to do is follow the blueprint and a beautiful house arises from somebody's head to the physicality of it, right? The building actually manifests itself. We can do the same thing. We can take you from terrible neuropathy and give you the blueprint and get you out of neuropathy 85 to 90% of the time. I'm not going to say we knock it out of the park every single time. So watch this. Who should get a consultation or an evaluation? So let's just look. Now I picked 9 common symptoms. It's probably going to be 20 of them, but the classics are burning, tingling, numbness. Those are the classic ones. If you have those symptoms, you should probably get a consultation. If you have cramping, sharp electrical pains, restless leg syndrome, definitely if you have balance problems, falling, if your sleep is interrupted from foot pain, tingling, hand pain, tingling, numbness, or other weird sensations like it feels like ants are crawling up my leg. It feels like I have a cardboard underneath my foot, but there's no cardboard. It feels like I'm stepping on leather. My hands just don't feel like they should. These weird sensations are signs that your nerves are dying off. You should get a consultation with me and see if we can help you out. Okay, so let's just dream for a second. I like to just imagine. Imagine if you could sleep through the night peacefully because your nerves are normalized. What if you could walk with confidence and begin to feel steady again, not worrying about falling? Okay. Imagine taking trips and enjoying family outings again. Can you imagine that? What would it be like if we really could reverse your peripheral neuropathy? I mean, just imagine. I mean, you only have one life to live. Are you going to keep living like this? See if we can possibly help you out with that. What if you could feel 10 years younger? So I'm going to make an offer, and don't worry, it's free. We're going to give you a consultation. I'd really recommend you take us up on it. It's a comprehensive consultation where you're going to learn more about our program. We're also going to learn more about you to see if you would be a good fit, a good match for the program. I'm not saying I can help every single person that comes in, but this consultation will actually help you and us to decipher if we're a good fit, if we think we can actually help you with reversing your neuropathy. And we're going to spend 30 to 45 minutes with you. learning more about it. You probably see a video about what's going on. The normal value is $150 for this consultation. Just to sit down with one of my staff people, it's $150. What are we offering it for? Get this, free, because you watch this seminar. Why would I do that? Because you're coming in pre-educated. You're coming in with the reality that, whoa, this is possible. Maybe I could be helped out. So if you're even the slight bit interested, then pick up the phone, click the link, do whatever you got to do to get a hold of us and get yourself on a free consultation appointment. Okay, so here it is. I think it's the next click. Free. There it is, free. Now, what I need to do is I need to share some testimonials of real live patients because some of you are still skeptical. It just sounds like he's trying to sell something, which I am, trying to sell that it's possible, trying to sell an idea. I'm trying to convince you that your body can heal itself and we can help it out, kind of like my plant friend right here. So look at this, look at these guys, 3 guys. I have hundreds. I've taken 1,000 patients through my neuropathy program. 85 to 90% success. This guy up here, he was virtual. He was in Ohio. I'm in Charlottesville. I never met him in person. Neuropathy in the feet feel better. Neuropathy in feet now 90% better. This guy is a firefighter, captain, couldn't drive the truck. Okay, got his life back driving the truck again as a captain. This guy right here, impossible. He was told that his neuropathy was impossible. There's nothing that can be done whatsoever. Not only did he reverse it, but look, he lost 20 pounds in his sugar. I think he ended up reversing his diabetes. Now, this guy right here had hand numbness. He's a carpenter, right? Using all kinds of heavy equipment, saws and screws, guns and things like that. Numbness in the hands are 100% gone. Tingling almost gone. Neck pain a lot less, okay? So I just wanted you to know that if one other human can do it, it means it's possible for you. It's possible. So ask yourself these questions. If I don't do this now, when? When is a good time to take the next step? Okay. The next one, I love this question as well. What if? And that to me is like, what if I could be one of these guys? Hey, somebody else did it. What if I could actually start to balance better? What if I could actually, what if it would be possible that I could reverse this numbness and this burning foot pain or the inability to tie up my own tie or tie my own shoes, zip up my own zipper? What if? It's possible. What if? So schedule our consultation today. We're going to put a link somewhere on here. You just click the link. We'll help follow that, set up that appointment for you. I really appreciate your time. You really stuck it in. I hope you took some good notes. And remember, click the link. It's free. If you go through the consultation, you decide it's not for me, just bow out. It's okay. But taking the next step is going to help you and us to see if you would be a good candidate. I think I'm going to end it there. I really appreciate you for attending, gave you lots of good data, lots of good information. I know sometimes it's like trying to drink from a fire hose, but I hope you got a lot of big sips and a lot of big gulps that it is possible and there is a better life out there waiting for you. I look forward to meeting you soon. Thanks for your time.